Hi, everybody. My name is Mike Dozeman. I'm one of the doctors with Faith Hospice, and we're going to be talking about hospice and how hospice can improve your quality of life today. The topic of my talk is, hospice, why sooner may be better. So a brief overview of where we're going to go over the next 35, 40 minutes or so. We're going to do a brief hospice overview and then talk about some of the benefits of early hospice enrollment and how this can improve your quality of life. This could easily be a couple-hour talk. We're going to barely scratch the surface today, but hopefully it'll at least give you an idea of what hospice can do for you. And there's certainly a number of other talks by other Faith Hospice employees that delve into some of these topics a little deeper. So what is hospice? I'm not going to spend a long time on this because some of my colleagues did a wonderful talk on this earlier in the year, and I would strongly encourage you to check this out. But I think it's imperative that people understand what hospice is and what hospice can offer so that you can understand how hospice can improve your quality of life. So this is a definition from the National Hospice and Palliative Care Organization. Hospice, the philosophy of hospice is to recognize that quality of life, peace, and comfort at the end of life should be the focus of healthcare when curing a patient's disease is no longer possible. This is a quote from one of my physician colleagues. You'll see these kind of scattered through the talk. I'm relatively new at this compared to some of my partners. They have a lot of additional wisdom and insights. So I asked them to kind of give me their ideas. So there'll be a lot of quotes from them throughout this lecture as well. But one of my physician colleagues said, it's persuasive to at least learn all about hospice care so that you can make an informed decision based on good information about when hospice services would be of benefit. I think we all realize that we make better decisions when we're not in a time of crisis. So hospice eligibility. Simply, 2 doctors must certify that a patient is terminally ill with an expected life expectancy of 6 months or less if the disease runs its expected course. Important to know that this benefit does not expire after 6 months. We have plenty of patients who are on hospice longer than this. It's just that we would still continue to expect a 6-month life expectancy and that we're seeing declines while you're on hospice. Hospice services include access to social workers, chaplains, aides, nurses, administrators, pharmacists, therapists, physicians, and volunteers. As another one of my colleagues said, hospice is like having access to a candy store and the services are free. Notice the asterisks, free if you are on Medicare. If you have private insurance, deductibles, copays, etc., still may apply. I want to point out that Faith Hospice alone has over 150 volunteers with a wide range of expertise. So just one of the many benefits that come with being enrolled in hospice. Another slide just from the National Hospice and Palliative Care Organization talking about hospice and what it provides. So the interdisciplinary team with hospice helps to manage a patient's pain and other symptoms. We're there for patients and family members to help with the emotional, psychosocial, and spiritual aspects of dying. Hospice helps provide medications and medical equipment, help with caring for the patient and teaching families how to care for patients, providing grief support and counseling. There is short-term inpatient care available when pain or symptoms become too difficult to manage, or if caregivers simply just need a break for a few days, and provide grief support and counseling to surviving family members and friends after the patient has passed. Another quote from one of my partners, there is nothing new under the sun. As such, access to experts who have walked with other people down the path a patient and family are wandering helps to spare them wasted physical, emotional, spiritual, and financial effort at best. and multifaceted grief at worst. The people on our hospice team have a lot of experience. I've been doing this a long time, and provide just a wealth of knowledge for patients and families as they're going through a difficult time. Some hospice statistics real quick. So these are from 2018, which is the last year we have available. Over 1.5 million Medicare beneficiaries received hospice care in 2018, but only 50% of people who are on Medicare who passed while they were on Medicare were enrolled in hospice at the time of death. The average length of stay was almost 90 days, but the median was 18 days, which has changed very little in the last 1.5 decades. I include this slide simply to show that, I'm sure a lot of people use hospice, but there is a lot of room for improvement and a lot of people that could benefit from hospice enrollment. So that was a quick overview. Now let's switch gears and we're going to talk about how hospice specifically can improve people's quality of life. And I'm going to start with a quote from Atul Gawande, who some of you may know from the book Being Immortal. If you haven't read it, I would highly recommend it. It's a great look, into palliative care and hospice, and just kind of dying in America and what it looks like compared to other countries, and it's kind of how we can be a little bit of an outlier in our medical care. So this is a quote from him about patients who died in the hospital proved the least likely to have excellent quality of care near death, just 41%, or to die where they had wished to. Only 18% of people preferred to die in the hospital and did so. Which in my experience, I have met very few people who wanted to be in the hospital at the end of life. By contrast, patients who had been enrolled in hospice for at least 3 days had the best reported quality of life near death and the best alignment of care with their wishes. This is a quote, again, from one of my partners, just that sometimes it's helpful to call out some of the misconceptions about hospice care. A lot of people think, you stop all your medications, you go home, they give you morphine, and you die. And that's not the case. I talk about this with all of the patients that I see for the first time, that hospice focuses on feeling as good as possible every day. I want you to enjoy each day to the fullest. I want you to feel as good as you possibly can. So let's talk first about physical symptoms and how hospice can improve your quality of life from a physical sense. So screening for symptoms like pain, shortness of breath, nausea, constipation, anxiety, depression, just to name a few. Obviously, the list can go on and on. During your admission visit, nurses and physicians are going to develop a treatment plan with intensive symptom management to try to get things under control and get you feeling better quickly. And something that a lot of my patients really appreciate is that we try, if possible, to decrease your pill burden with a focus on medications that will provide quality of life. There are certainly a lot of medications that people are on that, when we think you're in the last months of life, these medications aren't going to provide the same level of benefit anymore, or we don't need to be as concerned about maintaining certain blood pressure goals or blood sugar goals or cholesterol goals. Obviously, there can be, I feel bad when I increase patients' pill burden, and sometimes that is necessary when we're controlling symptoms. But overall, our goal is certainly to decrease the number of pills you have to take. Included a couple of studies in here, just to give some data and back up some of the things we're going to talk about. So this is a study called The Quality of Life of Hospice Patients. And this study looked at or evaluated categories that they felt contributed to quality of life. These categories included symptoms, function, so like your ability to perform ADLs, like getting dressed, bathing, eating, walking, etc. Interpersonal relationships, well-being, which they defined as contentment, having your affairs in order, etc. And then transcendent, which is religious comfort, religious support. The results of this study showed that there were low scores for pain, nausea, shortness of breath, restlessness, and that patients were able to perform ADLs with only minimal to moderate assistance. And in the context of this study, the data demonstrated that hospice is able to quickly assess patients and provide excellent control of symptoms. Another study from the Journal of the American Geriatric Society, published in the early 2000s. This was a study looking at pain management for nursing home residents who are on hospice versus not on hospice. They found that hospice residents were twice as likely as non-hospice residents to receive regular treatment for pain. So these findings suggested that effective pain management of daily pain is better for people who are on hospice than those who are not enrolled in hospice. Another quote from one of my partners: really beneficial to become acquainted with the care team early so that they are familiar and comfortable with you and with your situation before a crisis hits. For many people, it's a great comfort that there is a team available 24/7, just a phone call away, without a trip to the emergency department, that we can get symptoms controlled, oftentimes with what is in the house already, just with a quick call to a nurse or a physician. Another quote from that study I just referenced a few slides back: if physical symptoms are controlled, patients can concentrate on meeting their emotional and spiritual needs and concerns, which to anybody who is suffering from uncontrolled pain, nausea, you name it, it's easy to understand that if you're miserable, it's hard to focus on anything else. So if these symptoms are controlled, it can make the rest of your life allow you to focus on other things that are important to you. I'll switch gears a little bit and talk about some of the emotional benefits of enrolling in hospice. So I want to start by mentioning a study from the New England Journal of Medicine from almost 40 years ago that talks about the nature of suffering and the goals of medicine. And part of this article talks about existential distress, which is really the emotional pain and suffering that come along with a chronic disease or a terminal illness, that angst that comes along with the dying process, anxiety, depression. As a lot of people know, having a terminal illness is not just physical symptoms. There's a lot of other things that go along with that. Other examples can be, as mentioned earlier, the feeling of having your affairs in order, having a sense of wellness. And just one area that hospice can help with that is that licensed medical social workers are a requirement of hospice, and patients have access to counseling services, amongst many other things that these social workers can help provide. So an incredible benefit that hospice offers, and one that a lot of patients take advantage of, and our social workers do incredible work. Switching gears just a little bit from the emotional well-being of patients while they're on hospice to their family members. And this was a study looking at depression in surviving spouses. I think this is applicable to surviving family members, after the patient has passed. And obviously, depression symptoms are going to increase overall for surviving spouses, regardless of hospice care. But this study showed that there was a reduction in depressive symptoms among spouses of hospice patients versus those who were not on hospice. Another benefit of hospice is the bereavement services that are offered, that there's bereavement phone calls to families of every patient who has passed. So just another benefit that can help with the emotional toll of a terminal illness. From a social aspect, I referenced the study twice already, and we'll reference this a few more times. But this study saw that the most important things to patients in the interpersonal or relationship dimension was that patients were concerned that their families appreciated them, that they would be able to say goodbye to family and friends, and that they would be able to express their feelings to families. This can be hard to do when you're stuck in the hospital. This last year especially is a great example of that, with visitor restrictions with COVID, and how hospice really enabled a lot of those social connections to remain and to flourish despite a lot of the restrictions that were in place. Going back to our social workers, I think they do a great job at helping to facilitate some of these conversations, and really getting to what matters, to patients and to families. This is something I talk about a lot with families when I visit too. So a lot of times before they enroll in hospice, I do some palliative care work, both in the clinic and in the hospital. And when I talk about the benefits of hospice, I talk about how hospice can help with the caregiving burden, allowing families to spend more time with their loved ones. They don't have to focus, spend all their time focusing on care, and focus on spending quality time with, their parent or spouse or child, you name it. Now, hospice is not a 24/7 nursing service. That is a common misconception. The bulk of the burden of care still falls on families, but there's a lot of education from nurses on how to make things easier. There are frequent nursing visits, aid visits. As mentioned earlier, there are respite stays available that Medicare will pay, for 5 days for a patient to come to an inpatient hospice facility, which Faith Hospice has at Trillium Woods. Again, just to give families a break and to help to reduce the stress that comes with caring for someone, with a terminal illness. From a spiritual standpoint, a couple studies we're going to look at here. When compared to national norms, participants in the study right here, again, the quality of life study in hospice patients. This is a different one looking at quality of life from the Western Journal of Nursing Research. They found that participants in this study had a moderate level of spirituality, a very positive view of their relationship with God, and a moderate level of life satisfaction and purpose. And in this study, they found that patients with terminal illness who selected hospice care may have greater spiritual and existential well-being than people who did not seek or accept hospice care. In my visits with patients, almost always their favorite person that they meet with is the chaplain. And a lot of times I get asked, when is the chaplain coming back? When is the chaplain coming back? Especially in West Michigan, faith can be a very important part of a large percentage of people in this area. And just hospice can help to deal with a lot of times some of the grief or anger or questioning that can happen in patients with a terminal illness, whether it is the patient, whether it is the family. It can be really helpful to have somebody to talk to. Another study just that showed that the most important spiritual concerns identified by 90% of participants in this study were finding strength in one's belief and finding comfort in faith. Again, something that a chaplain can really help benefit patients with. And having chaplain services is another requirement of hospice, whether it's Faith Hospice or one of the other hospice organizations in the state or in the country. This is something that all patients would have access to. Briefly touch on a couple of other benefits. So financial benefits. As mentioned earlier, hospice is a free benefit to people on Medicare. Medications that are associated with your hospice diagnosis are provided to you free of charge. There is medical equipment, so things like hospital beds, bedside commodes, walkers, that can make caring for someone at home a lot easier. Those things are provided for you free of charge. No more copays going to the hospital, no more seeing specialists, you name it. It can make a lot of financial sense and relieve a lot of financial burdens when patients are on hospice. This next point, just last week I had a long conversation with one of my palliative care patients about having more control over your life and over your schedule. This was somebody who, was really fed up with having to come to the hospital all the time, getting admitted all the time, was sick of doctor's visits, was sick of being poked and prodded, and just wanted to be at home, wanted to enjoy being out in nature. Somebody who really enjoyed having a lot of solitude, time alone. Said, hey, this hospice is going to help you do exactly what you want to do. Hospice is going to give you control over your life, over your schedule. There are certain requirements from CMS, from Medicare, that certain specialties have to visit, ever so frequently, but that can be minimized as much as the patient wants. And really, hospice doesn't have to be intrusive in your life, and it can give you a lot more control than if you weren't on hospice, if you're continuing aggressive care. And that, I think there's a lot of people who really appreciate that. No more trips to the hospital, as we already mentioned. I feel like that is a major reason that a lot of patients I see sign on to hospice is just they've been in the hospital 4, 5, 6 times in the last year and they're done. They don't want to go back. I want to stay at home. I want to be comfortable. I want to spend time with my loved ones. And that's it. Don't take me back to the hospital. And that last point, what I just kind of mentioned is I want to be with my family. I want to be with the people who are important to me. That's hard to do when you're in the hospital, especially in this last year. But even before that, it's hard to spend a lot of time with your loved one when they're not at home. Another benefit that a lot of people don't realize or haven't heard before is that actually people on hospice oftentimes will live longer. When you control people's symptoms, if you're controlling pain, you're controlling nausea, you're improving quality of life, it can make sense that people live longer. Depending on the disease, sometimes treatment can shorten lifespan more than the disease itself. Sometimes being on so many medications, there can be a number of things that can shorten people's lives. When you get into a hospice setting, there's been multiple studies that have shown hospice can lengthen your life. So there were 2 studies in the early 2000s, the journal Pain and Symptom Management, that showed patients who chose hospice care lived on average about a month longer than similar patients who did not choose hospice care. That may not sound like a lot, but in that situation, where to be hospice eligible, we think 6 months or less, getting an extra month of life is a big deal for patients and for families. Another study in the journal Palliative Medicine found that among patients whose life expectancy was only a few days, hospice correlated with a 44% longer survival. That's a huge difference. When the life expectancy was measured in months, home hospice care was associated with a 24% longer life. And there's a number of other studies that look at this too and show the benefit of hospice care on longevity. Another quote from Atul Gawande, just kind of, I think this quote is a good summary of what we just briefly covered. That is, the literature has established that when care is provided with a narrow focus on only disease control, so treating whatever the illness is, without palliative care or hospice expertise directed at eliciting broader goals, meaning what is important to the patient, and tailoring care to include, those goals, to include what's important. Patients experience more pain, more anxiety, families are more exhausted, they receive more non-beneficial care, they're hospitalized more, and they do not live longer. Indeed, studies suggest that early involvement of palliative care specialists, which would include enrollment in hospice, can produce increased survival. So, summary, which went through that a little quicker than I was expecting to, but anyone who has a disease that cannot be cured and has a limited life expectancy should look into hospice. Whether you're told by your doctor, there's really nothing more we can offer, you should consider hospice, or whether you're at a point where I don't want to do treatment anymore, you don't lose anything by looking into hospice. And I want people to remember that hospice is about maximizing life, not just death. Hospice, especially in the United States, has a very negative connotation. But just in the last year alone, I could give you dozens, if not hundreds, of examples of people who, once they enrolled in hospice, that their quality of life was so much better, they were so much happier, families were happier, and they were really able to enjoy time together and make memories that are going to be around long after the patient is gone. I'm going to finish with another quote from one of my partners who's been doing this for 35, 40 years. When my wife read this, she was like, oh man, that's kind of a hard quote to read. And I realized that this is kind of a punch in the gut. But I think in the United States, doctors often downplay things and downplay how sick people can be. And when I talk with patients, they know that they're not doing well, and they know that things are going downhill, even if people aren't telling them this. And so, looking into hospice you don't have to wait until a doctor tells you you should. If you think you might be dying, you should request a free hospice evaluation, not when you're sure you are. And hopefully this talk gives you a little idea of why that may be beneficial, because we want to improve quality of life. You want each day to be as good as it can possibly be for however long that may be, however much time a patient has left. We want you to feel well, to not just physically, but also emotionally. We want you to enjoy time with family. We want you to be where you want to be, if that's at home or, whether it's an assisted living facility, etc. Our goal is to make a patient's goals happen. So thanks a lot for your time, and feel free to check out some of the other talks on this website if there's other questions you have. Thanks.